height of the respiratory illness season is here, and hospitals are cracking down on visitor policies. Right now, hospitals in our area asking children under a certain age not to come inside those hospitals unless it's for medical attention.
You might remember a similar restriction happened at hospitals in our area last year. During this peak season of respiratory illnesses, our WBTV's Claire Kopsky spoke to a doctor who shared what to look out for and when it is time to go to the ER.
'Tis the season for the sniffles, sneezes, and coughing.
Kind of at the peak that we've seen so far for this year, so lots of infections, lots of ER visits.
ER visits for a slew of respiratory illnesses.
Things like influenza, adenovirus, and other viruses like the coronaviruses and COVID viruses.
They're illnesses that seem to spread this time of year.
Well, it's really hard going year to year since COVID because COVID really changed things. But if we look back more traditionally, yeah, tends to be kind of the peak time, the couple of weeks after Christmas because there's people traveling. So then that's when people get it and kind of spread it around, kids going back to school and spreading it.
The symptoms can range from the traditional sore throat, coughs, and stuffiness to something more serious.
Definitely. With flu, a lot of times it presents with fever, chills, and body aches before anything else. The ER, that's life-threatening stuff, so I can't breathe, I'm not feeling well, I think something's seriously wrong. That's when I would go to the ER.
So what can you do to help keep your family clear of these sicknesses? Dr. Atkinson says it's critical to pay attention to what you're touching, avoid touching your face, especially in public, make washing your hands with soap and water a regular routine, or at least use hand sanitizer when you're out and about. He also says a mask can be a good idea.
If you're going to be in large crowded areas, public transit, things like that, wearing a mask is always a good idea, and especially if you're immunocompromised or you're susceptible to viruses or have a disease that would make having that virus worse.
Other ways to give your body the best chance at warding off these respiratory illnesses: healthy eating.
As long as your diet's very balanced, plenty of vegetables, fruits and things like that, avoiding processed foods and staying healthy and active, I think that has a bigger impact than focusing on I need to eat 3 clementines a day and 2 lemons and 4 cucumbers, or I need to take 5,000 milligrams of vitamin C. Getting kind of bogged down in those numbers, I think, can be a little bit much, but just focusing on healthy choices overall is where I direct patients.
Healthy reminders to keep you and your family from making a trip to the doctor. In Charlotte, Claire Kopsky, WBTV, on your side.
And while we're in this respiratory illness season, every hospital system in our area has slightly different age restrictions on children visiting hospitals unless they're receiving care. For all those specific ages, you can go to this story on our website.